Today, let's begin with the other muscles which are attached to our scapula. So, attachments of muscles of scapular region except deltoid, because already we completed the deltoid in the previous video. So, now we'll discuss about supraspinatus, infraspinatus, Teres Minor, and also here will be the Teres Major, and next you also have the Subscapularis. Subscapularis is actually on the costal surface or the anterior surface, whereas this in Supraspinatus, Infraspinatus are on the posterior surface of scapula. So about these muscles we are going to discuss. So these are all the muscles which are in the scapular region. So also add deltoid to this muscle. Deltoid we already discussed just now in a previous video. So now we'll start with supraspinatus. So, supraspinatus is originating from the medial 2/3 of the supraspinous fossa of the scapula. This is called supraspinous fossa. This is actually the posterior surface of scapula. So, here in the medial 2/3, the supraspinatus is taking its origin, and it is getting insertion into the upper impression of greater tubercle of humerus. So, humerus have greater tubercle, right? So, in that greater tubercle also the upper part is giving insertion to the supraspinatus. So, which nerve is supplying it? The suprascapular nerve, according to its name only, supraspinatus, supplied by suprascapular nerve, and its root value is C5 and C6 of the brachial plexus. So, what is its action of the supraspinatus? The action is it's along with the short scapular muscle, and it stabilizes the humerus during movements of arm, and its action as an abductor of shoulder joint. It's an abductor, means it's bringing the hand away from the body, right? It's abductor of the shoulder joint from 0 degree to 15 degree in controversy. So this is the action of the supraspinatus. So for the abduction of the arm, that's it. So it's supplied by suprascapular nerve, and it's inserted into the greater tubercle, upper part of the humerus. Done. So how to remember it's attached to the upper part of greater tubercle of humerus? Very simple, as a name you can see the supraspinatus. Supra means upper, so like that you can remember, right? Next we'll see the infraspinatus. It is also very simple. It's in the medial 2/3 of infraspinous fossa of the scapula, its origin, and it is getting insertion into the middle part. It's insertion into the middle part of greater tubercle of humerus. So in the greater tubercle you have upper part, middle part, lower part. So that to the middle part the infraspinatus gets its insertion. So this infraspinatus is supplied by suprascapular nerve, the same nerve which supplies the supraspinatus. And what is the action of this infraspinatus? The action of infraspinatus is lateral rotator of the arm. Lateral rotation means it is turning like this, just it is turning like this, that is the lateral rotation. So lateral rotation of the arm is a function of infraspinatus. Next we'll move on to Teres Minor. If you see the Teres Minor, it's originating from the upper 2/3 dorsal surface of lateral border of scapula. This is the dorsal surface, this is the lateral border of scapula, this is the medial border of scapula, right? So from the lateral border on the dorsal surface, Teres Minor get its origin, and this Teres Minor is getting inserted into the lowest impression of the greater tubercle of humerus. So this all three muscles are very easy to remember. Supraspinatus insert to upper part of greater tubercle, infraspinatus attached to middle part of greater tubercle, Teres Minor attached to the lower part of greater tubercle, right? So this is about its origin and insertion of Teres Minor. So this Teres Minor is actually supplied by axillary nerve, and its root value is also C5 and C6. So this function is also same like infraspinatus, that is lateral rotation. So infraspinatus, Teres Minor both laterally rotate the arm. Done. So done with the Teres Minor. Next we'll discuss about the subscapularis muscle. So if you see the subscapularis muscle, it is present on the anterior aspect of the scapula. It's a multipinnate muscle. You can see here multiple fibers. Hence it is a multipinnate muscle. It is present in the medial 2/3 of subscapular fossa, and it's inserted into the lesser tubercle of the humerus. So it's inserted into the lesser tubercle of the humerus, right? So these all, the supraspinatus, infraspinatus, Teres Minor, these are all attached to the greater tubercle, but the subscapularis is going to attach into the lesser tubercle of the humerus. So the nerve supply of the subscapularis is upper and lower subscapular nerves, according to name. And what is the action of this subscapularis? It is a medial rotator. So till now you have seen the lateral rotators. This is the medial rotators, means it will rotate towards the side of the body. So it's a medial rotator and also an adductor. Adductor means moving towards the side of the body, right? So this is medial rotator and adductor of the arm, that is subscapularis. Next we will discuss about the teres major. So teres major will be here. So teres major is getting its origin from the lower 1/3 of dorsal surface of lateral border of inferior angle of the scapula, right? And it is getting its insertion into the medial lip of bicipital groove. You know, here we'll have the bicipital groove, this one inserted into the bicipital groove of humerus. So teres major is supplied by lower subscapular nerve, right? Same like our subscapularis. Subscapularis are both upper and lower subscapular nerve, but the teres major is mainly supplied by subscapular nerve, and its function is same like subscapularis, that is medial rotation, adduction of arm, same like subscapularis. So these are the different muscles of the scapular region, their origin, insertion, and also the nerve supply. Once again, let us quickly recap everything. So first we will see on the dorsal surface. On dorsal surface you have two muscles, Supraspinatus, Infraspinatus, and also on its lateral border you have two more muscles, Teres Minor and Teres Measure. So you know its origin, very simple. Its insertion is Supraspinatus, Infraspinatus, Teres Minor. Three of them will insert into the greater tubercle. But supra as a name, upper, so it will attach to the upper part of greater tubercle. Infraspinatus to the middle part of greater tubercle. Teres Minor to the lower part of greater tubercle. Very simple. And this Teres Major will attach to the bicipital groove. That's it. Next, coming to the subscapularis. Subscapularis is a anterior side muscle. It is a multipennate muscle. It will attach to the insertion into the lesser tubercle of humerus. So these are all are attached. The dorsal surface muscles of scapula are attached to the greater tubercle, whereas the costal surface muscle subscapularis is attached to the lesser tubercle, and the teres major is attached to the bicipital groove. That's it. So very simple. And coming to the nerve supply, this one supraspinatus by suprascapular nerve, and infraspinatus also suprascapular nerve, teres minor by axillary nerve, and subscapularis by upper and lower subscapular nerves, and this teres major by lower subscapular nerves. So that's it. We also completed revision, very simple topic. Next we will start with intermuscular spaces, and also we need to discuss the rotator cuff.